I recently ran a poll to ask doctors if they mention the NCCN guidelines in appointments with newly diagnosed patients. And 70% of them said that they do, which was a number that I was a little bit surprised by because I don't know very many patients who learned about the NCCN guidelines through their doctor. So then I asked patients the other side of that question. I asked if they had ever had the NCCN guidelines brought up or mentioned to them by their doctor. And 90% of patients said that their doctors hadn't mentioned them. I think the discrepancy here might be a communication thing. So let's talk about what the NCCN guidelines even are. So the NCCN guidelines are recommendations that a doctor might use in determining treatment options for different types of cancer. They have recommendations for all the major types of cancer, so not just kidney cancer, but they're also not just meant for physicians. They have an entire section that has the recommendations for treatment options, but also a whole bunch of additional information specifically for patients. And boy, do I wish I knew about this when I was first diagnosed because it would have answered so many questions that I had. Here's just a couple examples of what the kidney cancer one includes. It includes information on the different subtypes of kidney cancer, which is super important to know beyond just clear cell and non-clear cell. It talks about and explains different blood tests that you might receive, what biopsies are, all the terminology, and what biomarker testing is. It talks about the different stages. There's also a page talking about grade. They also talk about who all the people are. When I was first diagnosed, I knew nothing about cancer. I didn't know who any of these people were. And I didn't understand why I had to keep explaining the same thing to a bunch of different people. But that's because I didn't know who each of the people were, and that a lot of the times I was talking to the residents and fellows. I didn't know what a fellow was. I didn't ever watch any of those TV dramas. So if you were like me and didn't know anything, this document has that stuff. And then towards the bottom, it also has treatment recommendations. These are the guidelines that physicians often use. So this one, for example, is for stage 4 for clear cell. These are the preferred options, recommended options, and use in some cases. It's important to note that these are guidelines, so they're kind of just guardrails, and your physician will adapt them to your specific case to help make the best treatment decision for you. For example, what I had is so rare, it really didn't fall into some of these guidelines, and that's okay. But it's important to know about these things so you know what questions to ask. So these are the guidelines for stage 4. They also have an entire section for all of the earlier stages, talking about what the recommended treatment options are, what type of surgery is recommended, as well as any follow-up. In my personal opinion, these guidelines are the most comprehensive resource that exists for patients. We actually talk about these guidelines in the latest episode of Oncology Unscripted. That episode is on second opinions, and these guidelines can help you understand what questions to ask when you're going for a second opinion. And Julie also shares how she wouldn't have gone for so many if she would have known about these guidelines. So be sure to check out that podcast and to look up the NCCN guidelines for your cancer.